Systemic exam. The neurologic exam begins when the patient first enters the room. With toddlers especially, watching the child when they don't realize they're being observed can give you valuable information.
Hi, if it's okay, we're going to be doing a neurology exam with you today, Michaela. Does that sound all right? Good. Could I ask you to come around here and hop up on the bed for me?
Begin with a full set of growth parameters plotted on an age-appropriate chart. These include height, weight, and head circumference. To measure the head circumference, a tape measure is placed on the occiput and brought anteriorly to just above the eyebrows. 3 measurements should be done, and the average of these taken as the head circumference. A smaller or larger than normal head circumference can be a sign of underlying pathology. For example, a small head circumference or microcephaly can occur with intrauterine infections or chromosomal abnormalities. A large head circumference or macrocephaly can be the first sign of hydrocephalus. Head circumference should be measured at every physician visit until children reach the age of 3 to determine the rate of growth. If a child's head measures outside the normal curve, the head circumference of both parents should also be taken to identify the possibility of a benign familial pattern.
Perfect.
The neck should be examined to ensure that it is supple and that no meningismus is present. Specific physical tests for meningeal irritation include Koenig's and Brudzinski's test. Koenig's exam is usually performed with the patient supine and the knees flexed. An attempt to straighten the knees is made. The inability to extend the patient's knees beyond 135 degrees without causing pain constitutes a positive Koenig sign. Brudzinski's neck sign is performed by placing one hand behind the patient's head and the other on the chest while the patient lies supine. One hand flexes the patient's head towards the chest while the other restrains the patient from rising. Flexion of the lower extremities, hips and knees, constitutes a positive sign.
Say that for me. Swing your legs over. Any bumps or bruises or birthmarks that you have?
As the skin and central nervous system both develop from the ectoderm during embryogenesis, a full examination of the skin should be undertaken. Hyperpigmented lesions, such as cafe au lait spots of neurofibromatosis, and hypopigmented lesions, such as ash leaf spots in tuberous sclerosis, are best seen with a Woods lamp. The Woods lamp exam is performed using a black light to look at the entire surface of the skin. Also examine the back for scoliosis or a patch of hair, which may indicate an undetected vertebral anomaly.
Very good. Up we go. All right. So we're going to test your
Cranial nerve 1.
That's what I want you to do.
Cranial nerve 1, the olfactory nerve, is purely sensory and is rarely tested in the screening exam. If there are any concerns raised in the history of a change in taste or smell, each nostril should be tested separately using a non-noxious smell such as mint, orange, or vanilla. The ability to smell the substance is more important than the ability to identify it correctly. Cranial nerve 2. Cranial nerve 2, the optic nerve, carries all sensory visual information to the cortex. The first step in examining cranial nerve 2 is to determine the visual acuity of each eye.
Get you to cover one eye.
This can be done with a wall-mounted Snellen chart or with a handheld card.
Okay. Now, can you read the bottom letters?
There are also age-appropriate charts with pictures for younger children.
Excellent.
If the child wears corrective lenses, they should wear them during the visual acuity testing. Once the acuity is determined, color vision is tested.
Now we're just going to check your color vision.
Proper color discrimination requires the presence of normal cone function.
What color that is?
If you do not have a formal color vision test, such as the Ishihara plates, you may ask the child to identify a green object and a red object.
Yeah, good. All right, one more. Okay, cover one eye. How about this one?
Green.
Huh? And now try the other eye. Does it look the same from eye to eye?
Pupillary response to light
Use the light
tests
now.
cranial nerve 2 for the afferent portion and cranial nerve 3, the oculomotor, for the efferent.
See?
Shine the light directly at the pupil and watch for direct as well as consensual response.
And just
The swinging flashlight test is done to test for a relative afferent pupillary defect. This test is done by shining the light first at one eye, then the other, and watching for a change in pupillary size. If one pupil is larger with direct stimulus than with consensual response, then that eye has less light perception than the other. Fundoscopic examination is a very important component of the cranial nerve 2 exam. The optic disc, vessels, retinal background, and fovea should be visualized for abnormalities. This can be quite challenging in children, requiring speed and creativity in distraction techniques. If there's concern about abnormal findings, a dilated exam should be performed. To examine the child's right eye, use your right eye and hold the fundoscope with your right hand. Similarly, use your left eye and left hand to examine the child's left eye. A fundoscopic view of the eye is shown here. Finally, visual fields are tested. There are several methods for this test that are all effective. The key is to ensure that all 4 quadrants are tested in each eye at their outer limits. More accurate formal perimetry testing is available if a problem is identified. Field deficits can be used to localize problem to pre- or post-chiasmal, optic tract, optic radiation, or occipital cortex. Cranial nerves 3, 4, and 6. Cranial nerve 4, the trochlear nerve, and cranial nerve 6, the abducens, are tested together with the motor component of cranial nerve 3 through testing of eye movements. Cranial nerve 4 controls the superior oblique muscle, and cranial nerve 6, the lateral rectus. Cranial nerve 3 controls all other muscles of extraocular movement. Ensuring that cranial nerve 6 is intact is especially important in cases of suspected increased intracranial pressure. Due to its long length, cranial nerve 6 is often one of the first nerves affected as pressure increases. Start by inspecting the child's head position to ensure that it is straight when both eyes are looking forward and that no ptosis is present. Have the patient follow a finger or object to the extremes of the visual fields to test pursuit eye movement. This is best done using an H-shaped pattern. At the end of this pattern, test convergence by having the child focus on a finger as it is brought close to them.
Good, that one's silly, huh? All right, and can you just look straight at my nose, look straight ahead? Very good. Now I'm going to hold my finger here, and I'm going to hold my thumb up over here. And I want you to look from finger to thumb when I ask you to, okay? So look at my finger, and look at my thumb.
Saccades are tested by having the child alternate their focus rapidly between 2 objects in both the horizontal and vertical planes. In both saccadic and pursuit movement, watch for nystagmus at the extremes of gaze.
Finger, thumb, finger, thumb. Very good. That was
Cranial nerve 5.
okay.
Cranial nerve 5, the trigeminal nerve, has both sensory and motor
We're
components.
just going to test.
The sensory component can be tested using light touch and temperature bilaterally on the forehead, cheeks, and chin to examine all 3 of the peripheral divisions: V1, the ophthalmic division, V2, the maxillary division, and V3, the mandibular division.
Okay, start again.
Testing the muscles of mastication, as well as for the absence of the jaw jerk, examines the motor component. Cranial nerve 5 also carries sensory information from the cornea via the V1, thus carrying afferent information of the corneal reflex, while cranial nerve 7 carries the efferent component.
Very good. Okay, and I'm going to put my finger on your chin, and I'm going to tap it. Okay? Good. And that's all I do.
Cranial nerve 7. The functions of cranial nerve 7 can be summarized as face,
So I just want you to
ear,
kind of do what I
taste,
do.
and
Okay?
tear.
First thing, lift your eyebrows.
Specifically, the facial nerve innervates the muscles of facial expression, the stapedius muscle of the ear, taste to the anterior 2/3 of the tongue, and the parasympathetic supply of the lacrimal glands. The muscles of facial expression have an interesting pattern of innervation in that the upper portion of the face is innervated by both the right and left cranial nerve 7, while the lower half is entirely the ipsilateral nerve.
Very good.
Cranial nerve 8. Cranial nerve 8, the auditory nerve, is screened by testing hearing. If hearing in one ear is decreased, the Rene and Weber test can be done to distinguish a conduction versus sensory neural deficit. The Rene test compares conduction of sound in air with that of bone. A tuning fork is first held in front of the ear and then held to the mastoid process.
So what we would do is I would hit it.
Bone conduction is louder in conductive problems, while sensory neural deficits yield the same result for both, or perhaps slightly louder for air conduction.
Very good. Okay. Same thing. We'll test the other ear, okay? All right. Tell me when you don't hear it buzzing anymore.
Now.
Good. Do you hear it? Do you feel it buzzing there?
No.
No. All right.
In the Weber test, a tuning fork is placed on top of the head. If hearing improves in the deaf ear, a conductive problem is present, while if true sensory neural deafness exists, there will be no change. Cranial nerve 9, 10, and 12. In the screening exam, cranial nerve 9, the glossopharyngeal nerve, and cranial nerve 10, the vagus, are tested together via the gag reflex. The afferent component is carried by cranial nerve 9 and the efferent by cranial nerve 10. Cranial nerve 9 also carries taste from the posterior 1/3 of the tongue and autonomic innervation of the salivary and parotid glands. Speech and pronunciation tests can be done to test the recurrent branch of the laryngeal nerve of cranial nerve 10, in conjunction with aid from cranial nerves 5, 7, and 12.
Side to side. Very good.
Cranial nerve 12, the hypoglossal nerve, controls tongue movement and is tested at the same time as 9 and 10. When the child's tongue is at rest in the mouth, the tongue should also be inspected for fasciculation. Cranial nerve 11. Lastly, the spinal accessory nerve, cranial nerve 11, is tested through its control of the sternocleidomastoid and the trapezius muscle.
You lift your shoulders up like this. Don't let me press them down. Keep them nice and strong. Perfect. Just relax your shoulders. Good. And now we're going to test your neck muscles, okay? Look over at that curtain over there. Yeah. And now I'm going to try and move your head. And don't let me move it. Keep it strong. Very, very, very strong. Good job. And now the other side. Good. Keep it very, very, very strong. Good job. Okay.
Begin the physical exam by inspecting the limbs for symmetry, muscle bulk, and
Take a
posture.
look at the muscles in your hands. Okay. Muscles here. Look for any extra movements. Good. Now I want you to go nice and floppy. I'm just going to move your arm around, okay?
Tone can be assessed by passively taking the limb through the range of motion. Spasticity, an upper motor neuron sign, is felt as an increase in tone that varies with the force applied and the velocity of movement. Rigidity is increased tone that does not vary with velocity or position.
Up like this. Put your arms up. Don't let me press them down.
The strength of each muscle group should be tested and graded from 0 to 5.
This. Don't let me.
Begin with examining arm abduction. Always remember to compare side to side.
Now I want you to
Then proceed with elbow flexion, elbow extension,
push, 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 push. Good. This one, push, 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 hard as you can. Good job. Take your wrists and go up like this.
wrist
Don't let me press them
extension,
down. Keep them strong. Very strong. Good. Down like this. Don't let me pull them up.
and wrist flexion.
Very good. Fingers flat out in front of you like that. Don't let me press them down. Hold them nice and strong.
Finally, examine finger extension
Fingers wide apart like that. Don't let me press them together.
and finger adduction.
Like that. And like that. Very good. Relax. We'll test your reflexes up here, okay? I'm going to use the big
Deep tendon reflexes are graded from 0 to 4.
Try not to concentrate on what I'm doing. Try and think of other things. Okay?
Begin with examining the biceps reflex bilaterally. Then proceed with the brachioradialis reflexes.
Good. Now this one is, I'm going to hold your arm up like this. Let it go nice and loose. Let me support all of its weight, like spaghetti. I know your arm's heavier than that.
And triceps reflexes.
Good job. This one, same thing. Nice and loose, like spaghetti.
You may also
Really
wish
heavy arm.
to examine finger flexor reflexes at this point in the exam.
Good job. Okay. Now we're going to test the muscles in your legs, okay? So we'll get you to lie down, actually. All right? There we go. Perfect. So, what I want you to do...
We will now move on to lower extremity testing.
Up off the bed.
Start by assessing strength, beginning with hip flexion, extension, abduction, and adduction.
Okay, you keep it up. Hard as you can. Hard, hard, hard. Very good. Relax that one. Same thing with this one. Lift it up. Don't let me press it down. Strong, strong, strong. Very good. Relax. All right. Now, I want you to try and press your legs down into the bed really hard. Don't let me lift them up. Strong, strong, strong. Very good. All right. And press your legs apart. Really strong against my hands. Good. And in. Really strong against my hands. Good job. All right. Let's finish testing those leg muscles. Lift this leg up off the bed.
Then proceed with knee flexion and knee extension.
Now, I want you, don't pull your heel to your bum. Pull it hard as you can. Pull, pull, pull. Good. Now push up like you're going to straighten your legs. Straighten, straighten, straighten. Very good. Relax. Put that one down. Let's do this one. Up like this. Bend. Pull your heel to your bum. Really hard. Good. And then push out. Hard as you can. Hard, 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 hard. Very good. Relax. And I want you to
Continue with
toes
ankle
up to the ceiling.
dorsiflexion.
This. Up to the ceiling. Up, up, up. Yeah. Don't let me press them down, okay? Keep them nice and strong. 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 Very good. Now this big toe here.
Extension
I want
of the
you to
great
keep it up.
toe.
Really strong. Don't let me press it down. Keep it up, 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 up. Strong. Stronger. I know you're stronger. Very good. This here. Keep it up. Very, very strong. Strong, strong, strong. Hard as you can. Good job. Now I want you to press down on my hand. Like you're
And
pressing
ankle
down
plantar
the back.
flexion.
Press hard. Good. And press here. Press hard. Good job. Now just relax. Let your
As
legs
with the
release
upper
and this is
extremities,
steady.
assess for
Okay?
tone.
I'm just going to move them around. I'm going to move them around like this. Good. Now keep your leg nice and loose. There we go. Perfect. Good job. All right, now I'm going to bend this knee a little bit like this. And just relax your ankle. I'm going to move your ankle, okay?
In the lower limbs, it is important to assess for clonus,
And then
a
up like
rhythmic
this.
series of muscle contractions present when there is increased tone.
Good job. Perfect. Now let's do those reflexes.
Next, examine the lower extremity reflexes. This can be done lying down or sitting up.
Okay.
Proceed with the patella reflexes.
Just like you were doing when I was picking your leg up. Good job. Just relax. Bend your knee.
This is hard.
I know it's hard. This one. Just relax. Just relax. There we go. Now I'm going to bend this leg like this. Right like that. Okay.
And the ankle reflexes.
There we go. And this one here, same thing. Bend. Very good. All
Then
right.
assess the plantar response by stroking the lateral edge of the patient's sole in a J stroke from heel to toe using a blunt object, such as the handle of a reflex
You can
hammer.
laugh. That's totally
The normal response is for all toes to flex, called
very good.
a flexor plantar response.
Stretch.
When there is an upper motor neuron lesion, an abnormal reflex occurs where the great toe extends and the other toes fan out.
Legs nice and loose.
This is known as an extensor plantar response, or Babinski sign. Finally, test for crossed adduction.
Good.
The sensory
All right.
exam.
So I'll get you to sit up for me, because we'll do the sensory exam. Yeah, perfect.
Moving from the motor examination, we will start the screening sensory exam.
Lots of tools for this part.
Sensory information is carried to the postcentral gyrus of the cerebral cortex in two major pathways. The dorsal column, which crosses at the level of the medulla, and the spinothalamic pathway, which crosses almost immediately upon entering the spinal cord. Both of these pathways carry light touch sensation, and thus, light touch using a cotton swab or other soft object can be used as a screening tool. Proceed by targeting specific dermatomes and test both upper and lower extremities. It is important to note that if an abnormality is found, the other components of the dorsal column and the spinothalamic tracts must be
The
tested.
other thing we can do, if you did have a
The
problem
spinothalamic
somewhere,
tract carries
okay,
pain and temperature sensation, and so can be tested using sharp versus dull and warm versus cold testing.
I'm going to ask you to tell me whether it's pokey or dull. So this is pokey, right? And that feels kind of dull. Yeah? Okay, so I want you to tell me pokey or dull. Sound good? All right.
Start distally and work proximally.
Pokey, dull, dull, pokey, pokey, dull, pokey, dull.
Very good. All right.
Temperature can be done using warm and cold test tubes of water, or, more practically, a tuning fork can be used.
Is you're going to close your eyes. I'm going to put this.
The dorsal column carries vibration sense.
Stops buzzing.
To test vibration sense, place your finger below the joint being tested and have the patient state when they feel the vibration stop. Again, start distal and work proximal, comparing right to left.
Okay, stop.
Very good. All right, let's do that on the other hand. Same thing. Okay, tell me when it stops.
Stop. Okay.
Very good. All right, we're going to do just a tricky one, okay? And so it's just testing if you can tell where your finger is in space, okay? So now, look at your finger. I'm going to move your finger. So you're watching. This is up, and this is down, okay? The tricky part is you have to tell me whether it's up or down with your eyes closed. Okay? So close your eyes for me. Just relax your
The dorsal
finger.
column is also responsible for carrying position sense, or proprioception, to the parietal lobe. Isolate one joint and perform small movements to test this.
Let's do the other hand. Same
It is
thing.
important that the
Alright,
patient
so we'll
describe
test same
where
way.
the distal
This
joint
way's
was
up,
moved to
that way's
and
down.
not the
Okay,
position that
close
the
your
joint
eyes.
finished in.
Ready? Okay,
Down.
very good. That is perfect. We're going to do your legs now. Okay? It's going to be pretty much.
After testing sensation in the upper extremities, remember to test light touch, vibration, and proprioception in the lower extremities.
Okay? Tell me if it's the same.
Yep.
Okay. Okay. Very good. Real quick, we're going to do the same thing with the tuning fork and the toe. All right? Here we go. All right. So here's the buzzing. I'm going to put it here. Tell me when it stops buzzing.
Okay.
Very good. And we'll try the other one too. Okay. There's the buzzing. Tell me when it stops.
Okay.
Good. So now we're going to do the same thing in the toe with the up and down. Okay? So, you can watch. This is up, and that's down. Okay? So I want you to tell me whether it's up or down. Okay?
Up. Up. Down. Down.
Very good. Okay. And this is up.
Up.
And that's down. Okay? You ready?
Up. Up. Down. Down.
Very good.
The final part of the neurologic exam is assessing the cerebellum.
Reflex hammer. And then
The finger-to-nose test is performed to test for dysmetria, which manifests as over or undershooting the target. In order to fully test the cerebellum's ability to modify movement,
hammer.
it is important to have the patient move through the full range of motion and reach complete extension.
Very good.
The cerebellum processes information from other areas of the central and peripheral nervous system to provide precise timing for coordinated and smooth movement of all skeletal muscles.
As fast as you can. So I'm
Rapid alternating movement is used to test for dysdiadochokinesia.
good.
Be sure that the child lifts their top hand completely off the bottom one between each touch. Observe the patient's rhythm and accuracy.
Good. Are you left hand or right?
Lesions of the cerebellum manifest as ipsilateral disorders of fine movement,
That's
equilibrium,
okay.
posture,
Now we have to do.
and motor learning.
So get you to lie back down. Okay. So now this one is kind of the same thing. Okay. What I want you to do is take this heel, pick it up, put it on this knee, and I want you to trace a very straight line all the way down your shin.
The equivalent tests in the lower extremities are the heel-to-shin test and the heel tap. Again, be sure to go through the complete range of motion. Observe the patient for accuracy and tremor while completing the heel-to-shin test.
Put it right here. Yeah. And slide all the way up to your knee and all the way back down. Nice and straight and up one more time. Good job. And relax. Now this one, be careful that you don't hit your leg, okay? Because what I want you to do is I want you to take this heel, bend your leg, right here. I want you to tap on your knee like this. Just like you're going tap, 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 okay? And make
Fast?
it nice and big. No, just about like that, okay? But you do it by yourself, okay? Good. Good, keep on going. Good job, perfect. Same thing with this one on this knee. Careful, nice up and down. Tap, nice big taps. Tap, 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 tap. Very good, that's great. All right, come up for me. Now we're gonna jump down onto the ground, okay? Good, just like that. So now I'll get you to turn this way, and this is a bit of a balancing act, okay? So I want you to put your feet together like this.
Balance, position sense, and proximal muscle weakness is tested with the feet together, arms extended, fingers splayed, and the patient's eyes closed.
Balance.
Watch for drift of the arms, away from the midline, as well as pronation.
Very good. That's
This
perfect.
test can also be abnormal in situations of increased intracranial
What
pressure.
I'll have you do is just walk across the room just the way you would normally walk, okay? Just walk all the way. Good job. And turn and come back to me and just walk.
Lastly,
normal.
have the patient walk,
Good job.
demonstrating
Now what I
normal
want you to
gait.
do is I want you to
Have
walk
the
over
patient
there,
walk on their
one
toes,
toes,
assessing
all the way
S1,
across.
and on their heels, assessing L5.
Good. Stop. Turn around. Walk on your heels like you're a duck. Perfect. Now this is a tightrope test. What I want you to do is I want you to walk like you're on a tightrope. So heel to toe. Heel to toe.
Then have the patient walk heel to toe, assessing their tandem gait
Isn't it?
forwards and
Maybe you can
backwards.
do that backwards. Try and do it backwards if you can. Yeah, all the way. Perfect. That's very good. You have good balance. All right, so I think that's everything for now, okay?